Osteoporosis is a medical condition in which, over time, the bones become more brittle and vulnerable to trauma, such as fractures from falls. They become weak. This is more common in women than in men. Bone strength is determined by 4 things: bone mass, mineral content, microarchitecture, and macroarchitecture. As physicians, we are primarily concerned with the bone mineral density, which tells us how much mineral is packed into the bone. The denser the bone, the stronger the bone. We obtain our peak bone mass by our early to mid-20s. There are several factors that can influence that, such as childhood health, genetics, and then other factors such as lifestyle behaviors, for example, smoking and excessive alcohol drinking can also contribute. And then there are medications such as corticosteroids and other chronic medical conditions that can also impact the bone mass. Osteoporosis is a silent condition. Our bones are remodeling all the time, where new bone and old bone is constantly being processed. But in osteoporosis, old bone destruction outpaces new bone formation. And over time, the bones become brittle and spongy. So how do we check for it? The United States Preventive Services Task Force advises physicians to screen women starting at age 65. However, women that are postmenopausal under the age of 65 and men with risk factors can be screened. The DEXA scan is a special type of X-ray that allows the radiologist to determine and interpret how much mineral is packed into the bones. There are 2 scores that are delivered to us, a T-score and a Z-score. The T-score gives you the bone mineral density content compared to the individual being tested versus an individual who is younger and healthier of the same gender. And the Z-score gives us the bone mineral density content of the individual being tested compared to a healthy individual in that same age group. A T-score between -1 and -2.5 indicates osteopenia, which is a precursor condition to osteoporosis. Your physician may choose to start you on treatment then, because treatment has shown to help decelerate, slow down the rate of further bone loss. Whereas if the T-score is -2.5 or lower, that indicates full-blown osteoporosis, and usually individuals are started on treatment. Why are women predominantly affected? So women reach a lower peak bone mass compared to the male counterparts by the early 20s. We have smaller, thinner bones, and we lose a very essential hormone called estrogen. Of the many wonderful things that it does, estrogen helps form bone. Without it, our bone loss greatly exceeds. Other factors such as having a low calcium diet and low vitamin D levels can also impact formation of osteoporosis. So what can we do? When I read about osteoporosis, I am concerned, as any woman should be. So there are some lifestyle changes that you can kind of watch out for. When we turn 65, the expectation is that you're going to a physician more often and regularly, you will be asked, you will be approached for screening. But until that time happens, watch your diet. Ensure that you have sufficient levels of calcium, but don't overdo it because calcium toxicity can cause problems. Get your vitamin D levels checked. The USPSTF does not direct physicians to check for vitamin D, but it is an easy blood test to perform, and vitamin D is available over the counter. Once vitamin D levels are back, if they're low, then you can benefit your bones by taking vitamin D. But don't overdo that either, because too much vitamin D can lead to toxicity. And then engage in weight-bearing exercises or resistance exercises. There is some evidence to show that weight-bearing exercises can help postpone or delay bone loss, and in some cases even preserve bone mass. If you're engaged in smoking and alcohol consumption, consider stopping. There is some evidence to show that excessive alcohol use does have a link. I'm Dr. Nazanin Jamal. I'm here to educate you so you understand how your body works. Follow me, I'll make the medicine make sense.